Staff Nurse Mama Hafiz, and this is my friend, Staff Nurse Mimi, and we are from the Hospital X. Hospital X. Okay, we are going to talk about how to care for the stroke patient. Okay, next. Okay, before we start, this is our learning objective, which is what ladies and gentlemen need to learn at the end of this presentation. Is what is stroke, state the sign and symptom, identify what is the basic need of the stroke patient, explain what is the physiological and the exercise for the stroke patient. Okay, before we start, do any of ladies and gentlemen know what is stroke? No? Okay. Stroke actually happen because of the lack of oxygen into our brain, which means that there's the obstruction in the blood vessel that carry the oxygen to the brain, causing the people to look very weak, have sudden loss of speech, and the paralysis on one side of the body. It's either like on the left or right, or the top and the bottom. Okay, we can confirm this stroke by scanning the brain with special X-ray tests and others. We can also call stroke is the brain attack. Okay, next. Okay, so how do we detect the stroke? First, the patient will have sudden weakness or numbness on the leg or on the any limb lah. Either from left or right, top or bottom. Okay, next, sudden confusion in speaking and understanding. Next, they will have the sudden troubleness in seeing either one or both eyes. Next, they will have sudden trouble walking, dizziness, and they will have the loss of balance. Okay, last, they will have severe headache without no cause. Like before this, there's no headache, no migraine, but suddenly they have severe headache. Okay, next. Okay, to make it easier, there's an acronym, stands for FAST, which stands for face drooping. Like to detect the stroke, we need to look for the face, either it's drooping or it's like when they smile, they will have uneven smile. Arm weakness. Is there like any one of the arms is weak, like they have difficulty to lift, to grab something. Okay, next, speech difficulty. Before this they can speak fluently, but suddenly they cannot speak fluently. They have difficulty in speaking. Okay. When we have all these FAS, we have recognized all these FAS in this person. We have to act immediately because time is gold. Go to immediate hospital to get the checkup, because if late prevention, they can cause death to the person. Next.
Hi everyone, I am Staff Nurse Shamini. Okay, all of you stay focused? Yes. Are you sure? Alright, so can we, I just want to gain your focus. Can we do some activity?
Yeah.
Can you cooperate with me?
Yes.
Okay, if I give one clap, you give one clap. So, and I give two clap, please give two clap. Just follow me, okay?
Okay.
Alright, one clap. Right, two clap. Give me three clap. Alright, give a clap to all. Alright, so we continue with basic needs of stroke patients. Okay, actually, we must know the condition of the stroke and signs and symptoms of the stroke. So if we have our close friends and our family members that have this kind of symptoms, we can educate them to get the yearly treatments to prevent it become worse. And we can educate them to do the passive and active exercise for the stroke patients. After this, my friends will show, and the prevention from become stroke, and actually the nutritional intake for the stroke patient. If we cook some food for them, we must give them soft diet, and we can cut them in the small pieces so that it's easy for them to eat, and educate them for the speech therapy. Alright, and then for the psychological needs, we must promote them with the positive talk and moral support for the stroke patient. Okay, this is exercise we can show, and I would like to invite our audience. Okay, sorry sir, can you cooperate with us? Can you be our model today? Alright, thank you. Okay. Staff nurse Hafiz will show us the passive exercise that we can do to the stroke patients.
Okay, so just relax and don't do anything, okay? Okay, the first one is the passive exercise. Okay, there are the passive exercise actually we help the patient to move their body. Okay, okay. First one is passive exercise. Okay, first we raise the leg, and then we give pressure to make sure their leg is bent. Okay, this is the first one. Okay, then straighten it back. Okay, the second one is okay. First, the second one is we raise up the leg, and then we twist it just a bit to the right, okay, to the left, and then to the right.
Alright, for the therapeutic exercise, actually we use the rubber band. Okay, thank you, sir. And we just follow the right, like the one like this. We do finger spread, full grip. Okay, you can try. The next one. Alright, and then how to prevent us from become stroke? Okay, we must control our blood pressure and blood glucose level by maintain a healthy diet. So, okay, Miss, can you give me some healthy diet for the stroke patient? Do you have any idea?
Low salt.
Yes, low salt diet. Thank you. You give the best great answer. So we must. We are recommended to eat actually not more than 6 grams of salt per day, and make sure that we eat high fiber diet. Don't consume a lot of alcohol, and make sure that we avoid smoking, because actually smoking can cause our arteries narrow, our arteries, and make our blood clot. Okay, and then the most important is regular exercise. Okay, that's all from us. And for the conclusion, I would like to invite my friend.
Hi, my name is Samia Zafira. Before I conclude our talk, I would like to do some revision. May one of you state the sign and symptom of stroke? Yes. Yes, you're correct.
Facial palsy.
Okay, thank you for your answer. Then for the conclusion, we know stroke is dangerous, and we have to give a good care for the stroke patient. So yeah, that's all from us. Thank you.